Hello, my name is Mark Wisniewski. I'm a registered nurse and a clinical supervisor in the emergency department of a Las Vegas hospital. I would first like to thank you all for allowing me to be here today and to speak to you about a very important issue, as well as an important piece of legislation that I think you will agree is long overdue in our state. Ladies and gentlemen, thank you so much for your attention for the next few minutes. In the state of Nevada, particularly Clark County, there is an ongoing public health problem that touches all of our lives in some way or another. Inpatient psychiatric services for the uninsured are severely lacking, and thousands of people are without comprehensive care as a consequence. Many of these people are unemployed or underemployed. Most live at or near the poverty level. Many are homeless. Less than a decade ago, we thought we were on our way to having a great solution. Las Vegas Mental Health received funding to build a large inpatient psychiatric facility in Las Vegas for the purposes of providing a no-cost healthcare option for Clark County residents suffering from psychiatric emergencies such as suicidal ideation, severe depression, paranoid schizophrenia, bipolar disorder, and substance abuse. Unfortunately, the funding for ongoing staffing and utilities and other costs was cut short almost immediately after construction of the building. The service has been running on very low funding, with a skeleton crew that only occupies a fraction of the dedicated building. Meanwhile, the housing crisis and concurrent recession has left many Clark County residents homeless and or jobless, which has contributed significantly to the problem of homelessness and the problem of depression, with suicide attempts rising sharply during the aftermath of the housing crisis. In 2009, Nevada's suicide rate was 19.1 per 100,000 residents, the fifth highest in the nation. That number jumped to 20.3 in 2012, the fourth highest in the nation. Furthermore, Nevada's suicide rate has consistently been higher than the national average since at least 1981. With the scarcity of resources in Nevada, it is often left to emergency department staff to deal with the heavy influx of patients. When a psychiatric crisis unfolds in Nevada, the paramedics, police, doctors, nurses, or counselors who discover the crisis are obligated to present the patient to the nearest emergency department for treatment and holding until a safe disposition can be made for them. However, emergency departments are not equipped to provide psychiatric services. They can only diagnose and treat physical medical emergencies. Emergency physicians receive very little training in behavioral emergency management in residency. Therefore, the staff in the ED makes an initial evaluation and then calls a third-party evaluator, mobile crisis unit, to make an evaluation of the patient. The patient is then put on a waiting list for inpatient care. This waiting list is often nearly 100 people long, and it can take up to a week for each individual to get accepted to a location. In the interim, patients are observed and medicated with the paramount goal of maintaining their safety and a sense of calm. This often means sedation. After several days of waiting, without appropriate psychiatric care, some patients become agitated, depressed, increasingly suicidal, and even violent. Add to that the fact that all patients who present to the emergency department for any reason whatsoever must be screened for suicidal thoughts and suicidal ideation upon their arrival, and the staff in all Nevada EDs is often overwhelmed for patients for whom they cannot provide comprehensive care. The Joint Commission began mandating suicide screenings in EDs shortly after it was discovered that up to 60% of all persons who attempt to commit suicide had reported an ED visit for some reason in the year prior to the attempt. 10% of all emergency department patients present with some sort of psychiatric illness, and many more have ongoing psychiatric diagnoses. Studies have shown that emergency nurses commonly feel powerless when attempting to provide comprehensive psychiatric care. Emergency departments have become more and more violent in recent years, with assaults on nursing becoming commonplace. In 2014, 75% of nurses experienced verbal or physical abuse. Patients are also at risk. Many Nevada EDs have special psychiatric holding areas that are specifically built to minimize opportunities for suicide attempts or elopement, but these areas are almost always full, and the rest of the psychiatric patients must be cared for in irregular emergency rooms, where there are tubes, lines, and even sharp objects that patients could use to hurt themselves or others. Statistically, the leading means by which hospital patients commit suicide is strangulation. We owe the public a better solution. The inpatient psychiatric care for uninsured patients must be provided with a reliable source of funding in Nevada, so sick patients can receive the care they need in a timely fashion, instead of languishing in holding areas where they are a risk to themselves and to healthcare providers. We are proposing that funding for inpatient psychiatric and drug treatment services be increased by $6 million statewide annually. Funds can be drawn from a variety of sources, including a tax on recreational marijuana use, the institution of a Nevada state lottery, and any funds that can be procured annually from the federal government. This would allow the Las Vegas Mental Health Inpatient Center to fully open with a total complement of professional staff, and increase funding for the Mobile Crisis Evaluation Department. Furthermore, a similar unit could be constructed in northern Nevada, perhaps Reno or Carson City, to serve that population. Additional funds for operating costs could be retrieved from Medicaid participating patients. In this way, Nevada can continue to abstain from collecting a state income tax. Individuals across the state will benefit from this program, as mentally ill persons will get the health care they need. This will contribute to a reduction in violent crime and burglaries in the cities, and will allow healthcare workers to focus on helping those who are suffering from physical medical emergencies without the constant fear of being assaulted by psychiatric patients. The current system of presenting patients who have psychiatric emergencies to hospitals is not inherently flawed. Many patients who are suffering from psychiatric emergencies are in need of medical care to stabilize their conditions. For example, it may be necessary to screen for life-threatening drug overdoses or self-inflicted injuries. It is also often necessary to differentiate between the illness that is truly mental and the illness that appears to be psychiatric but is actually a manifestation of a physical illness, such as an electrolyte imbalance or a brain injury. These individuals must all be screened by a qualified team of emergency medical professionals before being referred for psychiatric treatment. That is why the proposal only advocates for improving the availability of inpatient treatment beds and professionals, not changing the practice or the process dramatically. Once patients are screened and treated at a hospital, they should not have to wait for definitive care. It should happen within minutes. Appropriating the correct funds will ensure this safe definitive care. When you are casting your vote for this program, please consider that all Nevadans are affected by this problem. Healthcare providers are law-abiding, tax-paying citizens, and they are at risk. The recent housing crisis and recession has proven that any one of us can be destitute and in need at any time. Take it from somebody who cares for sick people every day. Tomorrow it could be me, or it could be you, who needs psychiatric help, or who is feeling suicidal. This illness knows no socioeconomic bounds. Besides, the funding is there for us. We just need to know how to take it. Please carefully consider what I am proposing. Human lives are at stake, and you can help to protect them by voting for this very important bill. Thank you very much.